Mo mono fatu lole pa ia ma le mo longa le aso, o ko susu mai ia ma nei le aso. Honor to all the dignitaries and the leaders this morning. The fact that you've come in today has made this day special. My name is Bruce Levi, Polotu Bruce Levi, Service Manager, proud Service Manager for Te Kanga Fohe, Pacific Mental Health Addiction Services in Waitemata District Health Board. Te Kanga Fohe means, it's a Tongan proverb, means unison of oars. So we've already talked about today around doing this stuff not in isolation with each other. Thank you for the speakers that have gone before me. Some of these things might be reiterations of what already been said, and that's fine. Just to make sure I know how to write it the wrong way. Just a reminder, by 2026, Pasifika will make up 10% of the population. 60% of our Pasifika are New Zealand born. The age structure of the Pacific population is young. 38% age under 15 years, average age of 21 as opposed to 35 for New Zealand overall. Very young population, growing faster rate than other groups. And our growth is going to come from our fertility from within here, then our migration. And a huge number by 2026. 36% of our Pasifika will have more than one ethnicity. And so I'm a child of the migration. I have children that are married to a Palangi, and they are also of more than one ethnicity. How do we create a world that they don't have to decide whether they're Samoan enough or Pacific or English enough? And so that's a challenge for us as services, even in cultural services. We've had this discussion before. So I'm hugely into the workforce. You've seen the demographic. How do we have a workforce that reflects it? We've talked a little bit about that. Just numbers-wise, we have very few dedicated Pasifika youth FTs across the country. We have 6 in our service in Auckland, because that's where most of our Pasifika youth reside. But in regards to the prevalence, still a very small amount. Cultural competency is very important, and not only around ethnic, but also the organisation. We saw the framework that Dr. Grant put up there, just to be able to navigate through that. You kind of need someone to be able to, and I was kind of referring to what they do in adult services, where they have navigators and they have community support workers. How do we have a little bit of that even within our own services to kind of bridge that gap, bridge the interface between services? And most of that's done within our own FTE. We do that extra mile just to make sure that transition is good for that young person, so they can warm them up to whether it be CAMS or whether it be whatever service that they need to go to. Pasifika worldview is very important, as our people, they're either born in New Zealand or they're traditional born, or I guess for myself, adaptive. And this is something that's come from Fumono Kapolotu Enderman, the creator of the Whanawhale model, where I myself, child of migration, grew up in Manurewa, went to Manurewa High, had a very good education, but I have a title from Samoa, from Whalealili, as kopolotu. So I suppose I'm in that middle part in regards to still holding roots in Samoa, but also Kiwiified, and very, very proud of that. So how do we have that pride instilled in our young people so they can be unashamedly so? And there's a growing population. There's not just New Zealand, but traditional born, but they call it the Nesian group, where young people are saying, we're neither traditional, we're neither New Zealand, but we're the kind of the Nesian mystics, or the Addies, or that group that's coming through our popular role models there in the arts and the music and the sports. I'll speak to that later on. So engagement's key. What does a youth worker look like? Well, you've got our brother Johnny sitting over there in Rubicon. He's probably nearly hitting 50 or so. But, and unashamedly so. See the experience that comes through. He's able to engage with mum and dad, but he's also be able to engage with the young person. And so, and also, in regards to the demographic, you'll have a spectrum of your workforce looking like myself. I still work with youth. I'm still a youth leader in my church at home in Auckland. And I suppose, you know, when you talk about the navigation roles, a huge role that the churches can play. Te Reo Matatini, you referred to that. Yeah, we've had a few go through that, and thank you. Because our people, well, it's about having that experience in addictions and fast-tracking them, particularly if they're good qualities. And at the end, and we've had a couple of really good stories, which I'll speak to later on. Bridging the gap, we've already talked about that. That's another issue. Our high and complex needs, our Pasifika, just in general, it cost more. They cost more to get services, always accessing services in crisis. And so we've struggled to get, I suppose, meet the threshold for severity. So what happens is services like mine, tupu services, they end up holding this risk. A lot of suicidal ideation. We need support like from Grant Christie to ensure that they're working in a safe manner. But that's an issue, and I think we've already referred to that. How do we make that a little bit more available? The 3%, I think it doesn't work for our pasifika people. Do we wait for them to be in crisis before they can actually meet the severity? No, I don't think so. But we're doing that with the current resources very well. Still an issue for us. Residential services. If there ever was a dream for the Pacific sector, and I've been around, I'm still a baby, but is to have our own Pacific residential service. Now, in the current times, we can't do it. We don't have the money. But we've had some good experiences within Māori kaupapa. With Odyssey, we have our current services, traditionally Odyssey and Salvation Army and Higher Ground. And it's been referred to that we have high dropout rates because of their roles in the family. So how do we as Pasifika be able to contribute to that space, contribute to the evidence of what's a good residential model for Pasifika? It'd be nice to have that, have that opportunity. So it could be working alongside with current services or similar-minded services like our Māori kaupapa services in Rotorua. Talked about great stories in the Raukura and Papakura in South Auckland, where 40% of the Pacific that come through are Pasifika. They have staff that are Samoan and Tongan. So there is about the environment, the workforce, to meet the needs of the folk that are coming through there. Last, some of the strengths or some of the solutions, innovate to create those opportunities. We talked about that. I think there's huge untapped Pacific kind of signposts, and I've just referred to it before. You've got Piri Wipu, who's now the face for Lifeline. Oh, is it Gambling Helpline? And then you've got Scribe, who's now the face for, I guess, the gambling sector. Which, these people with stories. Ronnie Clark, famous All Black. We got him through the Te Reo Matatini placements. Now he's working along as a practitioner. Now, we know there's that whole, we've got to ensure that he's got the credibility as a quality practitioner, but he has instant rapport. Families that open the door, because he's built that reputation. How do we harness a few more of those resources? And I think they do that well in HPA, in public health. How do we bring that here in the treatment sector? Because I think that's going to help warm the doors in regards to the interface issues that we've been talking about today. Tausi Levi, that's a concept in Pacific, where the VAR is the space. How do we continue to nurture that space between those services? So, Te Kaunga Fohe, that's our service. The 5C, we have this 5C approach, leadership. I present the corporate. I have my matua who presents the cultural. And then Francis Agnew couldn't be here today. He presents the clinical perspective. Johnny, who's our consumer advisor in the community. And you probably add more C's to that. But I think you have to have that perspective when you're addressing those issues, or else you get a narrow perspective. And I think, as I said before, leadership is key to ensure these perspectives are played out and we actually implement policy rather than, as said before. Harnessing the network, and we've just discussed about that, mandating grants to make this happen. But I think this huge, we've talked about sponsorship. Our youth team knew that there's no resources in DHB to get prizes for young people to come to these consultation meetings. So they, with Ronnie Clark's network is able to get Harvey Norman and Vodafone, those sort of things. Things very common in NGO land. And I suppose within the DHB provider realm, how do we be a bit more flexible? But we do that. Youth stories. We talked about the consumer leadership from the young people. Levi Workforce Centre, they're the kind of workforce centre for Pasifika, working closely aside with them and other NGO services. And our youth clinical networks within counties Manukau, given that that's where the majority of our Pasifika live in New Zealand. And in Auckland, we have networks between the CAM services and the youth services. And again, public health approaches. How do we squeeze a little bit of our resource to kind of bring that in? And I think we do the extra mile. We don't capture it enough. How we can, with the youth, just a few slides there of our young people working with the best training. There's an alternative education up in Auckland. And just looking as a therapy group and looking at what they'd written from their stories. Tupu, That's the service there, denoted by the new or the coconuts. It's an icon that's gone from being a negative to something of power. And Best Pacific Institution, just another of many alternative education that they work with. Me taku mata whakaolahi, mangaloa pito, pēnaka whakalevu, whaftahi tele lava.